And for our final chapter this week, let's talk about Chapter 8, Drugs and Substance Use Disorder. Substance use disorder is going to be a serious issue in a wide variety of nursing settings because we're dealing with some very addictive substances. These are chemicals with a high addiction potential. It wasn't that long ago where an Oxycontin was on the market, kicking off that opioid epidemic. Physical addiction works on the central processes of the brain, mainly that reward circuit. And this is where we get problems such as tolerance. And these patients need larger and larger doses to trigger that reward circuit, get that same effect, to get that same high. There's also a genetic component, as some people are much more predisposed to addiction than others. The first form of substance abuse we'll talk about is alcoholism. This is possibly the most common addiction out there, and there are more people addicted to alcohol than even they realize. Unfortunately, alcohol withdrawal could be one of the most serious and life threatening withdrawals there is as well. There are a lot of people out there who are functioning alcoholics. And unfortunately, with the withdrawal from alcohol, in serious cases, they can have a seizure and even be life threatening. We want to follow our CWAS, we want to follow our institution protocols very carefully and keep a real close eye on these patients. The next would be cannabis. This is becoming more and more legal across the country. I think what 38 states have it legal for medical, and well over half the population has access to recreational. Been in Ohio for a year now, recreationally, and I just think that's the way everything's going. Keep in mind there is some addiction and issues that these patients can face. Everything from changes in sleep, appetite, and mood, cravings for use, increased risk taking behavior. The next one is going to be opioids. Opioids is a very serious withdrawal. It also life threatening, but that's more so in the active high with the respiratory depression. While not as life threatening as say alcohol or benzodiazepines, it looks like a miserable withdrawal. I used to work in a dual diagnosis and detox in my earlier years in nursing, and it looks just like a flu. Their body aches, sweating. They just look miserable. The next would be tobacco. Those of you older in there may remember when smoking was everywhere. You'd have smoking sections in restaurants. I wasn't old enough for the smoking on an airplane, but I still remember seeing the ashtrays on there. And it's too bad nicotine's terrible for you. It's a mild stimulant that can also be extremely addictive. Another you'll hear more and more about on the internet is going to be cough and cold products, dextromorphan, promethazine codone, anabolic steroids is another one that is probably more common than a lot of us realize. And unfortunately, it has some serious effects on the body. I remember back in the 90s, all the steroid era of baseball. They used to have on a baseball card, they would include the baseball player's statistic. I think this was more HGH than actually the anabolic steroids. But for Barry Bonds, his head size doubled over the course of his career, which doesn't happen naturally. We want to take special care anytime we're dealing with both active intoxication as well as patients in withdrawal. As we said, especially when we start talking about alcohol, benzodiazepines, opioids, these are extremely serious forms of withdrawal. It could even be life threatening. We really want to be following our facilities protocol closely and really keeping a close eye and a thorough assessment. As we said, alcoholism is much more prevalent than we realize. We want to really be monitoring these patients for several days after they're admitted and keeping a very close eye on them. Everything from tremors, hallucinations, withdrawal, and seizures. We want to be looking for any signs and symptoms of drug interactions with pain medications, anesthesia, and keep in mind, especially with alcohol, these withdrawal symptoms can set in several days after they're admitted. So for the first few days, they may seem fine, and then they may suddenly start showing tremors, withdrawals, hallucinations, delirium tremors, DTs. When dealing with pain management for a patient with a substance abuse disorder, keep in mind that we still want to treat their pain. We never want to leave any patient sitting in pain. It's may have to be more careful. We're going to involve, let the patient know their options. But yeah, we never want to leave our patients in pain. The most commonly used drugs, talking about nurses with substance abuse disorder, which is much more common than a lot of us realize as well. Everything from cannabis, cocaine, opioids, alcohol, nicotine. Unfortunately, nursing is a very tough industry. It is a very tough profession. And people are going to get burned out and unfortunately seek illicit and illegal means of stress relief that unfortunately will pose a danger to their license as well. For tobacco use disorder, we want to assess their current smoking status and smoking history, determine their willingness to quit, and identify their locus of control. How much willpower do they have? Are they able to cope? Unfortunately, nicotine can be very difficult habit to kick. It is a very addictive substance. Generate solutions. Patients begin to identify ways to achieve control over nicotine use, and the patient identifies and uses available resources. The patient also demonstrates positive health maintenance behaviors, as evidenced by keeping the scheduled appointments and participating in a tobacco cessation program. Take action. Advise the patient to keep a list of slips and near slips to learn and avoid their causes. Assist the patient with problem solving. Encourage the patient to avoid environments and activities previously associated with smoking. Also keep in mind with those nicotine patches. Make sure the patient takes those nicotine patches off before bed, as those will cause nightmares. For our first practice question, a patient who smoked one pack of cigarettes a day for 2 years abruptly stopped smoking 2 days ago. Which of the following would the nurse perform an assessment on the patient and expect to identify as manifestations of nicotine withdrawal? Would this be A, increased appetite and blood pressure, B, restlessness and increased blood pressure, C, depression and decreased blood pressure, or D, nausea, confusion, and seizures? And that answer would be C, depression and decreased blood pressure. Which of the following does the nurse performing an assessment on a patient expect to identify as the manifestations of cocaine use? That be A, fatigue and hallucinations, B, cardiac dysrhythmias and violent behavior, C, shock and hypotension, or D, shallow respirations and pallor? And that answer would be B, cardiac dysrhythmias and violent behavior. And for our final question, a patient with a known opioid addiction is to have surgery. Which of the following is necessary in planning the patient's postoperative pain management? Would that be A, withhold opioid medications, B, treat the addiction before managing pain, C, provide pain management as needed, or D, anticipate that the patient will experience less pain? And that answer is going to be C, provide pain management as needed. We never want to leave any patient sitting in pain. Dealing with addiction and substance abuse can be difficult, and it can lead for a very stressful environment. Unfortunately, it's a problem that is going to be everywhere. I can't think of too many specialties of nursing where you won't have to deal with substance abuse in one form or another. But anyway, that's all I got for this week. I'll see you in the next slides.